It has been more than a month since Hurricane Maria just devastated Puerto Rico. Dozens of deaths have been linked to that storm, but for millions still living on that island, the fear is that long-term health issues are only just beginning. 10 News reporter Josh Sidorowicz talked with a USF doctor who just returned after spending almost a week on the island treating people at a remote hospital.
From a bird's eye view, Hurricane Maria's impact remains obvious, but on the ground in Puerto Rico, the impact on people's health is only beginning.
I think the long-term health concerns are going to continue for patients.
Dr. Asa Oxner and a team of USF physicians just returned from spending 5 days at a hospital in a rural central area of the island. She says the focus has shifted from initial treatment of traumatic injuries to now helping people cope with long-term health issues. The rate of diabetes, for instance, is higher here than in any state, according to the CDC. But for many, it is a condition that has gone largely untreated since the storm.
Now what we're seeing is people who they're having trouble accessing care.
One of the most crucial aspects of this trip wound up being the delivery of such basic medications as insulin to help so many people there who are just trying to treat their everyday chronic illnesses.
A lot of their warehouses were flooded just as much as people's homes were flooded. So they lost their medicine that they had in their house, and then they try to go get the stock refilled, and that was out too.
USF has delivered more than 1,500 pounds of donated supplies and medications, but that's the easy part.
They're still dealing with some infrastructure challenges. Getting supplies from where they come into the area and getting them distributed out to the community is always a challenge.
Another challenge, preparing for potential bacterial outbreaks, Oxner warns, like cholera. A serious threat as the struggle to get people clean drinking water persists. A sign that relief, while in no short supply, remains a long-term endeavor. Josh Sidorowicz, 10 News.
USF doctors plan on going back until they are no longer needed, and that could take months. They'll also continue working with local doctors in Puerto Rico to make sure they know what supplies they really need.